Can everyone hear me?
Yup.
Yeah.
Yes.
No,
Now you're back on mute.
my final paper when I was doing my master's, my computer like briefly blacked out while I was typing. And then when I finally finished it and went to upload it so I could submit it, it uploaded a blank document and then I couldn't open it. Huh? I'm on the phone.
But you're not on mute. But she is, so she need to come off of mute and video.
Bear with me a second while I try to reshare my screen. Okay, can everyone see my screen this time?
Yes.
Thank you.
Yep.
All right. Thank you everyone for joining and good afternoon. I'm sorry, good evening. Today I will be presenting my research proposal titled Sleep Deprivation and Depressive Symptoms Among College Students. Um, for sleep, um, For sleep deprivation, it has become an increasingly common among college students due to demanding academic schedules, employment, extracurricular activities, and also the increased technology use. At the same time, depression continues to be one of the most prevalent mental health concerns on college campuses. This study seeks to examine whether there is a significant relationship between sleep deprivation and depressive symptoms and whether sleep deprivation can serve as a predictor of depression. The findings may help universities to develop earlier intervention that improve both student well-being and academic success. So for this research proposal, there are three specific aims that I do intend to find within the purpose of this research. So the primary purpose of this study is to, again, examine the relationship between sleep deprivation and depressive symptoms among college students. For the central hypothesis, it is that students who experience greater sleep deprivation. I'm sorry. The central hypothesis is that students who experience greater sleep deprivation will report significantly higher levels of depressive symptoms than students who obtain adequate sleep. There are three specific aims. First, I want to determine whether a statistically significant relationship exists between sleep deprivation and also depression. Second, I would like to determine whether sleep deprivation can predict depressive symptoms, severity after accounting for other variables. And then finally, I would like to explore whether the demographic factors such as age, gender, and also academic levels influence these relationships. So understanding these relationships can provide valuable information for early mental health screening and also prevention efforts. So next is the background. And with the background, there has been, of course, previous research that consistently demonstrates that inadequate sleep and also frequently occurs together among all college students or most college students. Many students, of course, sacrifice their sleep due to coursework, employment, social activities, financial stress that may be happening, and also prolonged screen time. Of course, chronic sleep deprivation can impair emotional regulation, concentration, memory, and overall psychological functioning. So several studies have been found as strong associations between poor sleep quality and depressive symptoms. However, many of these studies were conducted within several single universities or different populations that also limit their generalization. This study addresses that gap by examining a broader population of college students while also focusing on prediction rather than simply identifying an association. Expanding this research may improve our understanding of how sleep contributes to student mental health across diverse educational settings. Next we have um, next we have importance. This research has important implications because depression affects far more than emotional well-being. Uh, Depression has been associated with depression has been associated with lower academic performance, decreased motivation, increased absenteeism, higher dropout rates, and reduced quality of life. Unlike many risk factors of depression, sleep is modifiable. Students can improve sleep habits through behavioral interventions, sleep hygiene education, counseling, and campus well-being incentives. Sorry. If sleep deprivation is shown to predict depressive symptoms, colleges could implement routine sleep screenings alongside mental health assessments. These findings may also encourage universities to develop educational programs promoting health sleep behaviors as a part of broader mental health incentives. Ultimately, this can help improve sleep for both psychological health and also academic success. Do apologize. Mm. Okay. Next, we do have the innovation. The innovative aspect of this study is that it moves beyond simply identifying an association between sleep and depression. Rather than asking whether the two variables are related, this study investigates whether sleep deprivation can prevent depressive symptoms. This distinction is important because predictive information can help identify students who may be at an increased risk before symptoms become severe. Another strength of this study is the use of validated instruments, specifically the Pittsburgh Sleep Quality Index, or PSQI, and the Patient Health Questionnaire 9, or PHQ-9. These standardized tools improve reliability, validity, and comparability with previous research, including demographic characteristics, which also allows for more comprehensive understanding of how sleep and depression may vary among student populations. So for this research, the method for this study is a quantitative correlation research design, because the goal is to examine relationships between naturally occurring variables rather than manipulating any participants. So approximately 250 to 300 college students who are at least 18 years old will be recruited through university email announcements and also community and campus organizations. Participants will complete 3 anonymous surveys. The Pittsburgh Sleep Quality Index will assess the sleep quality and sleep deprivation over the past month. The Patient Health Questionnaire 9 will measure depressive symptoms, while a demographic questionnaire will collect information such as age, gender, academic classification, and also enrollment status. Any participants is totally and strictly voluntary. There's also informed consents that will be obtained before the participation, and no identifying information will be collected to, of course, maintain confidentiality, because this study will only involve anonymous surveys that will also help to minimize the risk of any any participants that will be participating within the study. So for the data selection for the methods of the research, there will be several statistical analyses that will be conducted using SPSS. So first, the descriptive statistics will summarize patients' characteristics, including averages, frequencies, and standard deviations. Next is going to be the Parsons correlation coefficient that will determine whether a statistically significant relationship exists between sleep deprivation and also depressive symptoms. Finally, multiple regression analysis will determine whether sleep deprivation significantly predicts depressive symptoms after controlling for demographic variables such as age, gender, and also academic levels. Statistical significance will be evaluated using a p-value of less than 0.5, reporting effect sizes and confidence intervals that will also help to determine the practical significance of the findings, not just statistical significance. And then lastly, we have what will be our limitations, and is this research something that's actually going to be feasible? So like all research, of course, this study does in fact have limitations, because participants self-report their sleep and also depressive symptoms. Responses may be influenced by recall bias or social desirability bias. Additionally, correlation research cannot establish cause and effect relationships, while sleep deprivation may predict um, predict depressive symptoms. This design cannot determine whether one variable directly causes the other. Another limitation is that students experiencing severe depression may choose not to participate, which could affect the representative of the sample. Excuse me. Despite these limitations, this study is feasible because of online surveys are inexpensive, accessible, and efficient for collecting data from large student populations. Overall, this research has the potential to strengthen our understanding of sleep as a modifiable risk factor for depression and support future innovations designed to improve student mental health. And these are the references that I have used. And this will be the end of the presentation. I will now open up the floor for any questions next.
I got a question.
Go ahead.
Why did you select PSQI and PHQ9?
I'm sorry, say that one more time.
Why did you select the PSQI and the PHQ9?
Okay. So the question is, I just want to make sure I heard you correctly. Why did I select the two surveys, the PSQI and the PHQ9? Is that correct?
Yes.
Okay. So both of these instruments are widely recognized, validated, and commonly used for clinical practice and research. The Pittsburgh Sleep Quality Index provides a comprehensive assessment of sleep quality across multiple dimensions rather than simply measuring sleep duration. The PHQ-9 is one of the most reliable and validated depression screening instruments available and aligns with diagnostic criteria for depressive disorders. Using both of these tools, using validated tools improves measurement reliability and also strengthens the credibility of the study findings.
Okay, it's my question.
Go ahead.
How does this research contribute to exercise physiology?
Okay, and you're asking how does the research contribute to exercise physiology again, correct?
Yes.
As an exercise physiology student, of course, I could recognize that sleep is definitely a crucial component of overall health and recovery. Sleep influences physical performance, cognitive function, hormonal regulation, immune function, and also mental health. Understanding the relationship between the sleep deprivation and depression can help exercise physiology develop a more holistic wellness program that integrates physical activity, recovery strategies, and health sleep behaviors. This research supports the broader goal of improving both physical and psychological health through evidence-based interventions.
Okay, I have two questions.
Okay, go ahead with your first question, please.
How will you control for the variables other than sleep that may contribute to depression? And what if your participants don't answer honestly?
Okay, so first part is how will I control the variables between sleep that contribute to the depression, correct?
Just variables other than sleep.
Other than sleep? Um, so that one, depression is influenced by numerous biological, so, so psychological, and environmental factors. Although not every variable can be controlled, demographic information such as age, gender, and academic levels will be included in the regression analysis. Future studies could also include additional variables such as anxiety, physical activity, chronic illnesses, caffeine intake, financial stress, and also substances substance use to provide a more comprehensive model. And then your second question, if I answered your first question, your second question was, what if students do not answer honestly? Is that correct?
Yes.
Okay. Of course, would hope to encourage honest answers. Of course, participation will be completely anonymous, and participants will be informed that no identifying information will be collected. Anonymous surveys reduce social desirability bias because students are less likely to feel judged. And additionally, both the PSQI and the PHQ-9 have demonstrated strong reliability and validity across many research studies, which helping to improve the confidence in the responses.
Okay, so another question.
Okay.
If the study doesn't prove causation, why is it valuable?
Say that last part again.
Why is it valuable?
Why? Okay. If the study is not provide causation, why is it valuable? Is that what you said?
Yes.
So the correlation studies are often the first step in a scientific discovery. Demonstrating a strong relationship and predictive association helps to identify important risk factors that warrant further, investigation. If sleep deprivation consistently predicts depressive symptoms, future researchers can build upon these findings using um using ex I'm sorry, I'm losing my thought. Um other researchers can build upon these findings using experimental designs to better examine causal relationships. The findings can also inform early intervention strategies before causal evidence is fully established.
And why is this study important for colleges and universities?
So why is this study important for colleges and universities? Of course, college campuses continue to experience increasing demand for mental health services. With sleep deprivation, it's shown to be a strong predictor of depressive symptoms. Universities could incorporate sleep assessments into routine wellness screenings, counseling services, and also student orientation programs. Promoting healthy sleep habits may improve emotional well-being, um, emotional well-being, academic performance, student retention, and overall campus health, while reducing demand for, of course, crisis interventions before it happens.
What future research would you recommend?
So, what future research I would recommend? Some future research could include longitudinal studies that follow students over multiple semesters to determine whether sleep deprivation proceeds, depressive symptoms over time, and also experimental intervention studies evaluating sleep education, cognitive behavior therapy for insomnia or CBTI, or sleep hygiene programs could also determine whether improving sleep reduces depressive symptoms. Expanding research to different age groups, universities, and also cultural populations would further strengthen the generalization of these findings.
Let's see. How does this research contribute to exercise physiology?
I do believe that question was asked already,
Um,
but I will answer that one again. So as an exercise physiology student, of course, I do recognize that sleep is a crucial component of overall health and recovery. Sleep influences physical performance, cognitive function, and also, cognitive function, hormonal regulation, immune function, and also mental health. Understanding the relationship between sleep deprivation and also depression can help exercise physiologists develop more holistic wellness programs that integrate physical activity, recovery strategies, and also your healthy sleep behaviors. This research supports the broader goal of improving both physical and also psychological health through evidence-based interventions. All righty. And do you all have any more questions?
no.
Not for me.
No more questions.
Okay. Thank you, everyone, for participating in this presentation. I do appreciate your time, and I hope you all have a wonderful rest of your night. Enjoy.